Dr. Jock Murray is more than a past dean. He's more than a regarded neurologist. And he's more than a pioneer of medical humanities. It's our pleasure to introduce to you an insightful, generous, and inspirational force in the medical community, both here at Dalhousie and beyond.
Jock Murray was born and raised in Nova Scotia.
Well, I really loved growing up in the small seaport town of Pictou because there was a sense of freedom. I was one of 10 children, and if the local principal or the local constable was not appearing at the door, I was pretty well free to explore and adventure and have a wonderful time. So that was a very important part of my experience at that time.
He went to St. FX for undergrad. He went on to Dalhousie Medical School. He specialized in internal medicine and neurology. When I first finished at Dalhousie in medicine, I went out into family practice for a number of years. That was a very important learning experience for me. And most of my class did that. I later came back with the idea that I would do something in the area of general medicine or neurology.
His major contribution to improving the life of his patients has been in the area of multiple sclerosis. When I became interested in multiple sclerosis, I was doing some cluster studies in Nova Scotia, looking at areas that seemed to have more MS than others. But I came away from that with a profound feeling about the needs of MS patients, because most of those people out in the community felt abandoned. So at a time when he took this on as a research endeavor, there was not much one could do for patients with multiple sclerosis, but Jock put in place a database where he could carefully follow the progress of each patient, and to the best of my knowledge, that was the first such longitudinal database of patients with multiple sclerosis in Canada. He is a well-respected, accomplished specialist in medicine who recognizes the value and the importance of medical humanities, especially history, in understanding how we got to where we are now. And it's not necessarily that he's trying to predict the future, but he's trying to enrich our understanding of the present. Areas that I perhaps have made some contribution have been in the area of some of my publications. I've written a number of books, but two of them I think have had some impact. In addition to all his contributions and his publications, Dr. Murray has been generous in serving professional organizations for the history of medicine as well as medical organizations, and he has been elected president of a number of these organizations, showing the confidence that scholars place in him. I think I was also able to have some impact when I was chairman of the American College of Physicians, because in an organization like that, the largest specialty organization in the world, if you're the chairman of the organization, you can direct some things and make some things happen, and that was a very important time in my career. So it's no surprise that over the years, governments, including the U.S. Senate, have asked Jock to do more and more complex projects. I also was very pleased about a number of the Canadian organizations that we started. The network of MS centers in Canada, the Medical Humanities program at Dalhousie, the Dalhousie Society for the History of Medicine. During my career, I've been into the concept of collaboration. So I've written papers and done projects with my children and my wife. And that relationship has been really important in my career.
Outstanding clinician and mentor, innovative builder and passionate leader. Ladies and gentlemen, Canadian Medical Hall of Fame Laureate, Dr. Jock Murray.